in the room should have. If you took it and left it in your room, I'm sorry, because you'll have to remember all of this so you can go through the envelope later today. So I'd like you to open the envelope. In there is the briefing, which Stephanie has up, and we're going to go through the briefing. We're going to talk our way through this program, which for the Grange is a financial benefit. Just like Sister Betsy just talked about the program for vaccination, that we in turn now have a tent that can be used across this nation for events like Ag Day, Agricultural Day, which is held in the month of March in DC. We now have a tent that we can put up on a national mall next to the tractors and combines and Pioneer seed and everything else to advertise the Grange and hand out the material that we're going to share with you today. This contract requires us as Grangers to disseminate 150,000 information to 150,000 people across this nation. Rural is the focus. But this information I'm going to give you today, and that you're going to take away with you, is good for suburban. I'm a suburban. I was an urbanite before I retired from the government in Washington, D.C. I lived there. This is great information. And I have implemented some of it prior to getting on this program, but a lot more since I now have learned a lot more about what I can do to protect myself, my children, my family, my caregiver, whoever that may be in the future. Part of the contract requirements is we're recording today because we have to deliver to PCORI a video of this campaign kickoff. This is the kickoff of this program officially in the Grange. We won the contract June the 1st of this year. It's a 2-year effort to distribute or make contact with 150,000 people, which is a lot more than our membership. So this program moves out of your Grange Hall into the community, your church, your Masons, your garden club, the 4-H, the FFA. I'm going to tell you how we're going to do all that as we go through the packet that you have in front of you. So, do all the people we just talked about have the packet? The shipmates handed them out, either in the room or you took them to your room and you left them there. Okay. The second thing is, for later today, you're all going to need your cell phone officially for an opportunity we're going to do later on a different project. So if you don't have your cell phone, if you get it when we take a break, that would be great because you're going to have a prize later on for that. Thank you. So to kick this off, there it is, Patient-Centered Outcomes Research Institute, PCORI, are the funders. It's a firm fixed price contract, $248,000. to do this job. Every dime that we can save will stay with Grange. We're going to get $248,000 if we can validate that we have distributed 150,000 or exposed people to 150,000 people to this program. So we need your help so we don't have to spend half of that money trying to contact all these people. You're going to be key to this, and in turn, that money will help fund the National Grange based on our tenant loss in our building, etc. You all know the budget, so this is going to be a help. That's why one of the reasons that we tackled this. But mainly, we tackled this because this is something every one of us can use. So we have built videos. And we're going to show you a 2-minute trailer, and it features Grangers. We went all over the country. We interviewed Grangers. Samantha Wilkins was one of our actors. The lovely First Lady and First Gentleman from the state of Colorado are in the video. Their daughter, son-in-law, and family, Junior Grangers, are all in the full-length video. We have Stephanie is in the trailer. We have Grangers that are part of all the videos. We'd like to thank Phil for his work in DC to be a videographer. And then we have online with us right now is our professional producer of the videos, of which there are over a dozen that you'll be able to use throughout the next 2 years that we produce for you to make this as easy as possible for you to disseminate this valuable information. So here's our 2-minute trailer.
For generations, the National Grange has promoted the social and economic needs of American farmers. Grangers are practical, resilient people who love the land and the way of life it brings. You're devoted to your families, communities, livestock, and businesses. Grangers are often multi-generational, with parents passing down the strengths and benefits of their Grange membership to their children and grandchildren. The Granger way of life embodies the spirit of independence. However, 80% of Grange's 80,000 members are over age 50. The rural lifestyle that many Grangers enjoy can make it difficult to access healthcare or social support services. In Reaching Rural Surgical Seniors, we explore the challenges that senior Grangers and their families face as they prepare for surgeries. We spoke with younger Grangers, who are caretakers for their parents, and with older Grangers who describe their difficulties with planning for their parents' upcoming surgeries. We interviewed medical experts on how to best navigate an often confusing healthcare system and how to advocate for yourself and your senior loved ones. And we talked to National Grange leaders who understand the problems that all Grangers have in accessing healthcare while enjoying their rural lifestyle. All senior Grangers, their adult children, families, and caretakers will find a wealth of information to plan their upcoming surgeries and receive the best possible outcomes after surgery. If you're over age 55, chances are very high you'll need surgery as you get older. Reaching Rural Surgical Seniors is your guide to thriving in our challenging healthcare system.
Thank you. So that gives you a little taste of what we're going to be doing as a community of Grangers across this nation, is to share information that's helpful. You heard the statistics there. 50% of Grangers are 80% of the Grangers are 50 years or older. So this is key for all of us. All of us in this room can use this information. And we're going to open up our packet now and walk through the briefing first and then what's in the package that we're providing to you. I was told I have to stand still because I'm making the poor Zoom folks crazy. The ones online. Okay, so why the National Grange? And I spoke to some of this already, but there's a healthcare crisis in the United States, particularly in rural America. We're going to see some statistics. But the hospitals are closing down. 195 hospitals in rural America closed down in 2022. 195. So think about those folks now that have to drive so far to get care. There is an urgent need for information for them to think about what they want to do about their future when it comes to health care. Grange is there. We can reach the unserved or the underserved rural folks because we're there. We're in rural America. Those Grange halls that are sitting in your states are most of their members are in this age group of 50 or above. So we have the ability to make change. We can help people. So why is this such a hot topic? 97% of U.S. land is rural. This is from the Census Bureau, so these are given facts. Okay. 20.3% of our population nationwide live in rural areas, which is 1 in 5 of all people in America live in rural America, as defined by the Department of Census. Well, there it is, 195 hospitals closed in the last 2 years. I apologize, 2 years. 28% of rural homes today still lack broadband internet. Even though we're working so hard, an ACP program that Sister Betsy talked about a moment ago is on our agenda to try to get the internet pushed out as deep into rural America as we can. And hopefully you all are participating in that. That program also supplies you with all the materials. All you have to do is engage. All we're asking you to do is engage. A very sad statistic is the number, 64 to 68% higher suicide rate in rural America than in urban or suburban. And you know we have partnered with Rural Minds. I think this is the 3rd year, maybe the 2nd year. You're going to hear from them several times this week, including workshops. We, as Grangers, can help turn that. They just want an ear. Somebody needs to talk to somebody. If you see or feel somebody's in trouble, reach out. We can help. There's 20% fewer caregivers, primary caregivers, specialists in rural America. And I didn't realize that the most rural state in the nation is Vermont. Yay, Vermont! That's how they're categorized. I was shocked when I saw that, but I saw that was a little statistic I had to throw up on the chart. So challenges. We have so many challenges that this program, we hope, will help overcome. There's 6 key ones. And you can read them. I don't need to reiterate each one. But remember, we have patient language barriers with a lot of rural America, because a lot of rural America is Hispanic, Asian, etc., that need to take care of their health also. There are workers. They're the ones that are working, doing many of the jobs in rural America. So we can help them and disseminate some of this information. We have physicians' challenges. I highlighted that only 12% of the physicians in America are servicing rural communities. 12%. And yet, if you look at the statistic, 97% of the country is rural, with 20% of the population there, of the nation, but only 12% physicians. That's all kinds of physicians, including specialists. Very few specialists in rural America. So the hospital challenges. And many of you are experiencing this yourselves in your communities. They have low patient counts, therefore they don't make money, therefore they close. So it's a cycle that we cannot help as Grangers, but the unserviced and the underserviced populations that no longer have a hospital is how we think some of the materials we're giving you will help them think for themselves and self-advocate for how they can improve their health conditions. So rural folks themselves have challenges. There's social challenges. Oh, I can take care of it. You know, I can sew that finger back on that I just put in the combine. I don't want anybody to know that I fell and slipped. I'm embarrassed. I'll get up and hobble around and finish my work. Economic factors. Many rural and urban and suburban do not have health insurance coverage. Some of the, as you know, and you see it on TV every day, Medicare, Medicaid, the expenses involved in their health care eats up everything, all the money you get. So they don't get that prescription drug. They haven't thought through or discussed with their families necessarily what their health care is all about. So what's the results of that? Pretty scary. Rural Americans are more likely to die prematurely from the leading causes of death in the U.S., heart, lung, cancer, and stroke, than anybody else. Premature. Now, I don't want to die prematurely. I want to die old and healthy, and I think most of us do, or as healthy as we can be. And how can I do that myself so that I am not burdening the system, my children, a caregiver, grandkids, a nursing home? I would hope that I could stay home until the end. And then when is the end for me? Well, we're going to provide you something that helps you think through that. Like, how long do I want to stay on a ventilator or something? But we're going to get to that tool here in just a moment. So that's the challenges that we're trying to address with this program for PCORI, is how can we share information to overcome some of these challenges. And they look to us as that trusted messenger to mostly rural seniors. So the Grange program team, this is the team that has been working on this project since June. You'll know everybody on there except a couple. Olivia Casey is a hired hand, I'll say, because she's an expert in writing proposals, and she's the one that helped us formulate the contract bid. And she's been with us through the whole thing. She's not on with us today. Kevin Campbell is on Zoom. He's our gentleman from Colorado, the filming agency that did all of our videographies and the talkovers, the voice that you're hearing in the background on all of the videos and the lessons and everything else is either him or one of his staff. We had 2 doctors. The second one on the list there, the technical lead was Dr. Laura Ferguson. And Burton has known her from other project areas, and he brought her forward as our technical expert to help us with the proposal. And then we now have a Grange in Hawaii, and I have a friend there who's a doctor, Dr. Jennifer Walker, and she came on board and has contributed to her thoughts on, she is the rural health director in Hawaii, so she was also brought on. And then our shareholders, who is on the Health and Education Committee for resolutions that are in the room? Raise your hands, please. It's an interactive activity here. Okay. They were part of the process because after we developed words and documents and guides, we wanted to make sure that the process, this is the staff buildup. Then the first thing we did is we went out to regionals. Where's my regional POCs? Raise your hands. There's 5 of you. 2 are in the room. Okay. We had 5 regionals. And we sent material out to them to look at. So what do you think about this? How about the wording? Does it make sense? Will it hit the Northeast? Is the language right? In New Jersey, we have pork roll. If I put that in a video, the folks in the Great Plains wouldn't know what in the world I'm talking about. So they would maybe call it tailored ham, or maybe they don't even know what it is. So we wanted to make sure that the language that we used would work in every region of the country. So when you show these videos and you show the lessons, it will resonate with your area. So we compromised and we ended up making something that, so we only have one product in the end. PCORI thought maybe we'd have to build regional products that would be different for every region. Well, that's a nightmare for a program manager to try to keep that going. And so I said, we can do this. And then the Health and Education Committee, they were our shareholders. When we got to the 95% solution, they got engaged, and we sent it out to them, and they looked at it, and a few of them responded with a couple of comments, and the others out of you, I guess, were okay because we didn't hear from you. So we want to thank you all. And then we have the next slide, which are our videos. These are the actors, the performers that are part of the videos that you're going to see. All those folks, you recognize almost all of them except the bottom three. And those were folks that we gathered up in Colorado. Esther Vale I think she is like 78 years old, and she was our walker person and how do you get upstairs demonstration person. She did a great job. You'll see her. And she was an actor, and she did a great job. She was an actor. She was just a person off the street who played for us that role in the lessons that you're going to see. So thank you to Kevin, who's online, for getting his sister to loan us her home and his niece to play the caregiver nurse, and for finding Esther. So thank you, Kevin. Okay, so now we're going to walk through. Are there any questions so far on why the Grange decided to bid this project and win the contract? Do you think there's a need?
Oh, yeah.
You heard it, yeah. We heard a yes up here. Stephanie, you did a great job.
I've been recording, I'm sorry.
Okay. So if we walk through the envelope now, so you know what you're going to take with you. And what we're doing is this envelope full of material, exactly as you have it, including this briefing, is going to be sent by mail in January to every single Grange president in the country. So they're going to get this exact envelope. And you're going to see on the website when we go there that you're called out as a state leader. The regional folks that helped us build this package, they're on the front page because they've been involved in the process from day one. They might get a phone call. And I'm on there, you know, as a point of contact if there's information that folks need. So the summary of the envelope, you all should have a briefing on top. The next thing you should have is a letter that says, "Dear fellow Grangers." So this is the introduction letter that every Grange in your state is going to receive that talks about, it lays out the challenges in the first half, then it talks about what we're providing, it gives you the website information, and then what we hope your individual Granges will do. So we think we got it on one page, so I hope it's understandable to you all. I had it reviewed by one other person, or maybe two, so I hope that that makes sense to the Granges in your state. That's the sales pitch. The next thing you have, or should have, are a little pack with a staple in the upper right-hand corner. One's called website, and one is called National Grange Convention Campaign Kickoff Survey. Does everybody have those? Okay, put those aside, because we're going to fill those out at the end of this pitch. Thank you. The next thing that you have is a summary of everything that's available to the individual Grange to utilize. First, there's a little contract summary telling you what this is all about. Okay, they get an introductory letter. Now they're going to get, you have a contract, 150,000 exposure to this program. Aha, there's an incentive program. I'll tell you about that in a minute. Then the National Grange products, everything listed here on the bottom has been produced by your National Grange as part of this contract. The website, and I want to personally thank Stephanie so much for her great work in building that and loading it up, because it's going to be a tool for everybody that has internet and can use it. There's a promotional video, which is 23 minutes. There's the 2-minute one you just saw. There's a pre-surgery guide. It's a trifold, it's in your packet. There's a planning for my future guide. We'll be talking about those in a minute. There are 5 lessons on the stick. They're each about 6 minutes long. Every one of those lessons can turn into a lectures program. You can have an entire session, entire night of lectures or an open forum using one of these lessons. There's one on falls. There's one on hospitalizations. These are 6 minutes long. The doctors help us put these together. We have personal Grange taking part in those videos. It's informational and it's a lesson. Lesson, infrastructure, instruction, but you turn that into a lectures program. We're setting you up for weeks and weeks, months and months of lectures programs. Your lecturers are going to love it. They can read a little poem, show the video, or have everybody bring their phone, because most everybody has one these days, watch it on there and then have a discussion. Okay. There's 2 flyers in the packet that are for you to announce things. One is a full page. All these things that I'm talking about are on the stick, on the drive that's in your packet. Don't lose that. So you can advertise things you're doing. You're going to have an open forum. You're going to have you're going to go to the church, and the church you're going to have it on Saturday morning, a little forum on dangers of falls, or what happens if you go to the hospital, or you take it to your gardening club and you're showing them one of these along with how to plant a posy, whatever. There's a double flyer. There's 2. You can fold that in half and hand them out. Put them at the senior center. Go to your senior center, put a pile of these up and say you're going to have a program on this topic. Open forum. Anybody that shows up, we get credit for it. You have in your packet 2 report forms. Oh boy, they said we got to report something. Goodness sakes. Money coming your way. But these are report forms. One in May, with everything you've done by May of 24, just as held an open forum, 30 people attended. That's all it says on there. That's all you got to do. I'd like it if you sent a little more, but I don't need it. I've got to collect statistics. I've got to have metrics. I've got to have numbers. So if you work this program with your family at Thanksgiving next week, and you have 12 people around the table, and you talk to them and say, hey, I saw a great program. Here's the brochure. Here's the guide. Write it down. That's 12 people. Okay. PCORI does a lot of these awards every year. If we can really show that we can do this for rural America, we can get a lot of these and make money as a national Grange. It'll help our budget. It'll help us grow. It'll help us members, because we're exposing them to wonderful information. Next May, all state Granges, community Granges, You can email it to me. It's the address is on here. You can hard mail it to me. Don't care. So long. I would like to have that. And there is I think that, then in your folder, you have 2, let me think. So, my assistant, thank you, Vanna. So, I always have to do a gimmick. So there's a state range incentive program. Pink for your state range. I'm sure you know that. You, as a state range, the first 15 state ranges that meet, next slide, I'm sorry. I blew it. Okay. That's everything that's on this flash drive. That's in your folder. Look in the bottom of it. A little tiny drive. It has the Grange emblem on one side. On the other side, it has the name of the program. Reaching Rural Surgical Seniors. That's everything that's on that drive. All available for you. You don't have to rummage around with everything. You can show it just like we're doing today. You'll be able to share it, make a program out of it. It's available. We did that for you. What else is on the drive, next slide, are the lessons. They're all on this drive right here. So you can share it with any organization in town. There's nothing that you won't be able to do using this drive. The promotional videos are on there. I'm way too early. Way too early.
Yeah.
Okay. Now we'll move to the website. We're going to show you a couple of things from the website. I had my packet messed up. I apologize to you all and to the video. Sorry. Okay. This is the website that we built. This is the front page. And those in the back probably can't see this, but at the top, there are 10 tabs. Tab is where it says home page. Oh, here it goes. Okay. So we're going to show you 3 things on this tab, on this website. Just 3 because we can't go through the whole thing here. I'm good. No problem. So the website material, the content, the narrative of each of the tabs, I wrote from government sites, from sites that are put out by all pharmaceuticals, from universities, our technical POC, Dr. Ferguson, her book. So I used materials from official sources, which were then validated by both the doctors, that the material that is there, the narrative that is there, is A-OK. So we're going to share with you the narrative. There's a lot of text under each tab, which is why this turns into a whole program for your Grange to share with the Senior Citizen Center, with the 4-H. While we're working for that, I'm going to be sharing a subset of this with the youth and with the juniors this week, because this is important for them and their relationship with you as their parents, or their relationship with their grandparents. They can help their grandparents or parents or aunts or uncles fill out some of this data that we're going to show you in a moment. That will really be beneficial for the whole family unit. This isn't just for us old folk. It's for the kids to feel better, the children, the siblings, the grandkids to feel better because they know what their parents' needs are, what their parents' desires are. For those young folks, Joe, do you know what your mother wants if it comes to a ventilator?
Yes.
Great. You've talked about it as a couple. That's the communication that we hope this program will do between children and their parents, no matter what age that child and that parent is. So important that communicate. So now you can see the tabs that are across the top of our website. We have the front page. So the front page has a scrolling bar on it that is just some keys, scary, so really scary, but we have a way to maybe help you with that. It's one of the things in your packet. Then we go on down this page, and if we can, and do you have
Recording in progress.
Okay. Yep. So across the top are all these tabs, and within each tab, and we're going to open one up in a moment, but on down here, it talks about the Grange, because a lot of people that you may be sharing this with, we hope, really aren't too sure what the Grange is and what it does. So we have the problem. This is the long promotional video. It's 23 minutes. We showed it at New Jersey State Convention as my pilot program, and they were able to see what the program was about in total. There's the regional context. They're on the front page. These are all the people in the region that someone who sees this may want to call and say, hey, I'm going to call so-and-so in Connecticut because he must know a little bit about it because he's on there. Then on down, here's where you all are. At the bottom, we have the vision and mission statement of the project. Are you following me with that?
Yep. Sorry.
And then, right here, State Grange Contact. And when we open that up, all of your names and contact information shows up. So if somebody in your region really, or somebody in your state had a question, you might get, here you go, that's what's on there. Now, we know we have to update some of these because the state presidents have changed. I don't think we've done that yet. We will do that. Not yet. We will. And then on every page, this blue bar at the bottom is exactly the same on every page. And this is the PCORI statement that has to go on every page because they are our funder. So that's required to be there. We could go back up to the top, or close to the top, around the problem area. Homepage, problem. Okay, so here's the problem statement, and then immediately, anybody that goes to this page can go and see this promotional video, 23 minutes. Then they can go down and say, what's the solution? Grange is a solution to this problem, which I stated. Hospital problems, physician problem, local folk problem. Don't want anybody to know I'm hurt. This is the PBS commercial. How many of you remember the PBS commercial that was put together 7 years ago? 5 years ago? That's on here. So we're reutilizing existing material, because that's important. This was a great video. PBS ran it all over the country. We're using it again here because it tells the story of Grange. It's about 12 minutes long. If they want to know more about it, they can go there. 5 minutes, 5 minutes. They can also go to the National Grange site. So this is publicity for the National Grange. Now we're going to open up the Falls tab. There's a tab at the top called Falls. There's one called, hold on, Talking to Others. How do you talk to somebody else? You know, your diagnosis is not good. You go to the doctor, and probably the first time you go by yourself, and the doctor tells you bad news. How are you going to tell your family? how you're going to tell your children, your neighbor, and your best friend. There's some clues under that tab on how to do that. It's not easy. And I focus on this because we're recommending here that Thanksgiving is a great time to share and just start the conversation about your desires, your health care, what you want. Do you want to always stay home, or do you want to go in a nursing home at some point? You know, I'm okay with that, I'm not okay with that. Do I want to go to assisted living and have those wonderful times that they have at some point? Does your family know what your desires are? Thanksgiving is a good time to talk about it. So this is our doctor from Hawaii there. And we talk about paperwork that you should have prepared. We list them. Your living will, your advanced health directive, your power of health attorney, which is different perhaps in your state than your power of attorney for your finances. You need to check on that. This video will talk to you about that. But some of that, if they're not aware of it, this may make them aware of it. So that's talking to others. How do you ask for help from somebody else? That's part of talking to others. Now we're going to go to falls. Okay, so falls, this is our technical expert that helped us write the proposal and reviewed it all along the way. This is Dr. Ferguson. She's a doctor and she is a professor in Virginia at the Emory, it's right on here, Emory and Henry College School of Nursing. And so she was our one of our two technical experts. So here, and there's clips. So there's on this page, there's a clip from her. There's a clip from Sam and her experiences with her folks. As you all know, she left the headquarters and went back to Texas because her father was in need of assistance. So they went back to work the farm, to work with mom and dad. And so she's interviewed here. You have comments from her. Here is lesson 3. That lesson is the dangers of falls. It's about 6 minutes. All these lessons are 3 to 6 minutes. Turns into your lectures program. Turns into the program you present at the senior center, at the firehouse. Every organization can use this data. And it's so easy to share it. There we have Dr. Walker from Hawaii telling us her experiences. And that's it. And then the words. So every tab is like that. And now we're going to go to the video tab to show you everything that's available to you. This is under the very last tab. Videos, the PBS is there. National Grange. This is the 23-minute. This is the 2-minute trailer that you just saw. This is a recap of the Big E vaccination program that was just done in September. So that's on here. And that's important to tie these programs together. You know, we're tying all of our grants and our awards together, and you'll see that in a moment. On down, now these are the flyers that you have in your packet. But any Grange can print out more. They're going to get one of each, but there they are. They can go and print them out to advertise. Here is the briefings there's a youth briefing on this topic. Not like this, it's different. Here's the junior briefing is here on this topic, and your briefing. They're in the packet, so you don't have to create a briefing. You can use this if this hits the mark for your Grange. Now we have all these clips that have to do with a specific topic. More clips. On and on. So all this material is on the website. They're available. And on every single page, that was the front page, all those tabs, as a public, we're calling it a public survey. This is where, if you go here, please take this survey. That was automatically tallied. This only takes you a couple minutes. And that leads me to look at the two pieces of paper you set aside early, the two little packets. One called website and one called the public campaign kickoff survey. Okay, so this is our kickoff. So if you all could take a pen and fill out this kickoff survey. This is the only time this one ever appears, and this one will go away. But this will give us, this many folks are now aware of that program. How many people are in here? 70? 80? I have 80 for my 150,000. New Jersey State Grange, I did 2 presentations, so I'm taking credit for both of them. So New Jersey State Grange Convention, there I got 400 people, plus or minus.
There's a lot of percentages that survey.
The survey, oh, all the committees should have
All
them.
the non-delegates and all the.
Who did not get a packet altogether? National officers and committees, these are committee folks. Shipmates, can you distribute those, please? If you fill out the kickoff survey, you'll notice on there that question number 3 asks you if you have had your COVID shot, your flu shot, or some other shot. That will now be given, that information from today will be given to that team so they can count that into their database. So we're tying things in. The demographics in the front. How old are you? Are you the patient filling this out, or yourself? This is so we can report to PCORI that are you rural, suburban, or are you urban? So that's, and every single survey has these first 6 questions on it. They're all exactly the same. So this is interactive, so this won't take you long. You should be able to finish this in 4 minutes. The whole thing. Here you go, Betsy. Fill that now. It's the survey. It's not on slide. We need a packet back here. No, yes, sir, question.
When was the mailing out to every Grange again?
Every Grange will happen in January. I live in Florida now. January, I rent my house, and I'm going to go to D.C., and I'm going to sit there and write all these envelopes and mail this packet out. So during the month of January, however many I can get done every day, they're going to get them.
And
Yes.
the data that your mailings are going to go to, where we should be updating, because we're...
All we can mail to right now is the list that we have. So if you get that list to us, tying this together, you get a big incentive by the end of this year. More money if you get your list updated. If not, we're using the list we got. There's nothing else I can do.
I was considering sending a mailing to my Granges to, tell them to expect this.
Great. So we're going to get it. I'm going to have, fast as I can write, we're going to get them out in January. It's going to come U.S. Postal Service. So fill out that survey. You all tell me when you're done, because we have another interactive little thing for just a moment. As our PCORI, come on. She is, okay. Our contract person from our funder of this project is now with us on Zoom. And we'll get to her in just a moment.
Hannah, can you hear me?
Yes, hello Rachel. We're so glad that you joined us. We are just doing a kickoff campaign survey right now of these are the presidents in the room, the presidents of the states in New Jersey, in the United States that are with us in the room, as well as the directors of some of our committees are in the room, and they are currently filling out the Kickoff campaign survey to give us our first set of data, that they understand the program and what we're doing. So that's what's occurring. They're still writing, so we'll wait a moment before we have you speak. Did you just get on? Did you just get on?
I have been on since 2:10, so I've heard the whole presentation so far.
Oh, wonderful. I'm glad of that because I started speaking and you weren't there, we weren't sure. So we're so glad you're with us.
Very happy to be here. I was going to present some content, but I'm not sure whether that's going to be a problem on your end.
Okay.
Should I try?
Yes, let's try while they're filling out the survey.
Okay.
Okay, Stephanie and... Okay.
Fantastic.
She wants to make sure it's going to work. You're working? Okay. Thank you.
Wonderful. All right, so while we're doing that, let me just...
Now, delegates, are you still working? Still working. Okay? Now, the other items that are in your packet is a trifold. You all got one of these, but you can print as many as you want. On your stick that we're giving you, what you're getting is two versions of this. The one we're giving to you is the high resolution. It's called Print High, which will cost you a little more because it's glossy paper. It has a lot of yellow and a lot of blue on it. So if you print that or put it in your computer printer at home, it'll use a lot of ink. On this stick also is the version without all this color, black and white. So if you're going to the fair, you're going to your 4-H fair, your county fair, the Grange fair, and you want to have these there, you can print them in a less intense color version at Kinko's or at your Grange office or at home and hand them out at the fair. So we're trying to make sure that you have the tools you need. It isn't going to cost you an arm and a leg to do it. But this trifold is the guide for pre-surgery. This guide, these questions were put together by PCORI, so I'm so glad she's on. The Research Institute, PCORI, developed 11 questions that you should ask your surgeon or your doctor when you go to visit. They're here. We added 3 more, so there's 14 altogether. And these questions were vented through our 2 doctor consultants of what you and we are recommending everywhere that you have somebody with you. An advocate, a person that is not so nervous about what they're hearing that they can hear and take down notes for you. Maybe this is a good tool. This is the guide. This is what we're paid to distribute, this guide. Okay. Now, Rachel, they're almost done filling out their kickoff, so we'd like to go with you. We haven't talked about the other guide yet. But if we don't want to hold you up. So at this point, I would like to introduce our program officer from PCORI.
Thank you so much. It's really great to be here at this kickoff, and it's been wonderful to hear from you all so far. You know, that's what you're aware about the project, how it's relevant to you, etc. I am going to share a little bit about what PCORI is and does, and a small amount about the project, but we've covered quite a bit of it already. So I'm going to talk a little bit also about some of the funding that PCORI provides in the areas of rural and senior health, and just some information about how you can get involved in what PCORI does if you're interested, because there are a number of ways to get involved with this work. So this is what I'm going to discuss briefly, just beginning with who PCORI is and what PCORI does. So PCORI stands for the Patient-Centered Outcomes Research Institute, and it's, our mission is to fill a need, as was already mentioned today. Too often patients don't have the information that they need to make informed medical decisions. They want to know which preventative, diagnostic, and treatment option is best for them specifically, and so we fund research that seeks to answer those questions through a form of research called Comparative Clinical Effectiveness Research, or CER, which looks at 2 or more different medical treatments, services, or health practices. And then the findings from those studies help patients and other partners figure out what's best for them in terms of the medical decisions that they want to make. We also fund, in this case, this is an engagement award, so we fund projects that work to disseminate the results to the most appropriate audiences. And we also fund some other types of work in terms of implementing the results of the studies in healthcare settings, and also on research methodology to improve how research is done. And the purpose of doing this kind of work is that traditional healthcare research doesn't always answer questions that patients are facing, and too often patients and those who care for them don't have the information they need to make those decisions, which is why PCORI's research focuses on conditions and different types of healthcare challenges that people experience every day relating to cancer, diabetes, opioid use, etc. And at the core of the type of research that we fund is also the understanding that empowering patients with better information means that outcomes for better health overall will be better. We also believe that patients deserve to know whether some approaches are better than others for specific populations, and believe that the people who provide that care should have access to that information as well. A key feature of the work that PCORI funds is that it is deeply engaged with patients and other relevant people, depending on the type of study it is. That can mean that there are caregivers involved. It can mean that there are hospitals or health systems involved if it's a treatment option where you really need to be partnering on a systems level for things like that. So this is just a slide, that shows us who our stakeholders are, who the people are that we partner with on the research itself, and also who the people are that we hope to disseminate the results to. So just a couple of notes on research through engagement. Like I mentioned, foundational to PCORI's work is that patients and other partners really do need to be involved in the research process, not just at the stage of sharing the information. So although you all are involved at the dissemination stage, sharing this information to your communities, the studies that you're sharing the results from were done in a patient-engaged way, meaning that at the leadership level from the studies and all the way throughout all the activities, there was some patient involvement to indicate that what was being done was relevant and useful, was going to yield results that people could actually use, and they weren't just subjects of the research, but they helped to guide it. And what we mean by that is, as I mentioned, disseminating the results is certainly a big piece of that, but even from the planning stage, so patients being involved in the formulation of the initial research questions and coming up with a study design to weighing in on things like a recruitment strategy and how to retain and keep patients engaged in the study throughout. What are some things to consider in terms of analyzing the results? and then the best way of positioning those results so that they're useful. So the guides that have been adapted for this project are based on guides that were shaped by patient input initially, and then the idea of projects like this is that you can adapt them so that they make sense for particular audiences. This is just a snapshot of the investments that PCORI has made in funding research on both rural and senior health. We unfortunately don't have a cross-section of the two, but as far as breaking out these two different areas, there's quite a bit of money that's been invested from PCORI into this work. I've broken it down based on our research awards versus our engagement projects. This is an engagement project as opposed to a research study. Generally, we have smaller budgets, which is why these numbers look lower on the engagement side. The research awards tend to be for millions of dollars over multiple years. And I'm going to dig a little bit deeper into this, beginning with rural health. So as I'm sure you're aware of, there are millions of Americans living in rural areas that have a challenge obtaining appropriate healthcare services. And I heard that statistic about the hospitals that are closing in rural areas and the populations based there versus the number or percentage of doctors practicing there. So obviously, this is an area where we need to be thinking about different types of solutions so that people living there can receive care that is accessible and helpful to them. This just shares some examples of the research studies that we have funded in this area that also show a little bit about what we mean by comparative effectiveness. So this first study here is comparing 3 different ways to offer a weight management program to patients living in rural areas. And the 3 different ways really speak to the fact that you might not have access to in-person care. So one of those ways was an in-person group visit at a clinic with 8 to 18 people per group. The second one was a remote group visit by phone with 10 to 17 people per group. And then the third way was in-person one-on-one visits at a clinic. And in terms of the results, after 2 years, it turns out that in all 3 ways, patients lost weight and had improved physical activity. Compared with the in-person visits that were one-on-one, patients who had in-person group visits lost a greater percentage of weight, had a decrease in fat levels, and had greater increases in physical activity. There are more results than that, but this is just to give you a snapshot of the types of information that our studies yield. This is an example of studies that we funded under Rural Health for the Engagement Award portfolio. So this first project, My Plate Dissemination for Latinos in Rural Communities, was an engagement award where they took the results of a study that focused on this concept of My Plate, which was, formulating healthy and culturally appropriate meals for communities who have limited food access. And so the dissemination award was finding the best places to share the information from the study, one of which included a food bank where they were able to provide recipes that had been developed through the patient-engaged work on the original study, along with the ingredients that the food bank could provide. So just some kind of creative ways that you can think about the dissemination of the results of these studies. Moving on to older adult health. These are just some high-level stats that I think are of interest. So we have median life expectancy of the U.S. population here for 78.6. The Medicare expenditures for older individuals and people with disabilities from a few years ago at $737 billion. And then the number of studies, large-scale research studies that PCORI has funded to help older adults and caregivers make their better informed decisions about healthcare options. The number of people living in the U.S. over the age of 65 is rapidly growing and is projected to reach about 95 million by the year 2060. Which obviously means the U.S. healthcare system is facing barriers to address the complex care needs of these older adults. And so our funded portfolio focuses on that. There are a few different studies highlighted here. I'm not going to go into too much depth except to say, at least for this first one, it's focusing on a condition that tends to affect older adults. So although it's not squarely focused on older adult health, it's something that's particularly helpful when thinking about the population and what would be of interest to them in terms of surgical treatments, the burden on individuals and families, and whether or not there are differences in terms of the outcomes. So those are some of the things to consider, especially when you're thinking about older adults and the kind of intensity of the treatment options available. And here are a few examples of the older adult focused projects from the Engagement Awards program. And the purpose of the Engagement Award projects, as opposed to the dissemination projects, are that it's working to engage populations in the research process. And in this case, that's a really big challenge for older adults, recognizing that a lot of the ways to engage can be tough if you happen to be homebound, if you happen to not have access to technology, or if you have needs that can't necessarily be met by virtual engagement in research. So a lot of the work that we fund in this area is around making sure that we can do things like bridge the virtual divide, make sure that older adults do have input on the research process, and that there are ways for them to be meaningfully involved. So I shared some examples of work that's done in these two areas. Now I'm just going to kind of frame up where the National Grange Engagement Award falls in the program itself, so you can have a better understanding of the type of work overall that the Engagement Award program funds. So as I mentioned, the purpose of the award program is to build a community of patients and other stakeholders that are equipped to be partners in the research process, starting from the very beginning all the way through to the end and disseminating the results of those studies. This program does not conduct research, so the project that we're discussing today is considered programmatic support and is, of course, disseminating results from research studies that have already been conducted. This information was actually just released today, so just to note that we have these 3 different funding opportunities, and our next deadline was just released with the information open. There are higher funding levels available for the 3 different opportunities in 2024. The first deadline for the spring is going to be in April, and then there's going to be a fall deadline to be determined. But you can do a capacity building project or a dissemination initiative project for up to $300,000 for up to 2 years, or have a stakeholder convening focus on engaging in patient-centered outcomes research for up to a year for up to $125,000. The dissemination initiative, which this project falls under, is really looking at leveraging pre-existing relationships, which is why the Grange is such an excellent organization to be doing this work with. Obviously, the foundation of the relationships that you all have is incredibly strong and goes back a long time. So this is exactly the kind of group that we're super excited to see taking up PCORI findings, adapting them, and trying to put them into practice, sharing them with folks. There are other examples that we found are also incredibly productive, like in communities of faith or pre-existing research networks, other sorts of states or regional collaboratives and associations, where this work has been really productive and exciting. The research results that are being disseminated through this project are considered eligible because they've been published in a peer-reviewed journal, which means they've gone through a sort of rigorous process to be made publicly available. And I think that's all I'm going to say about that. So, the National Grange Engagement Award. I was going to share more about this because I wasn't expecting so much to have already been shared, but just to say, I linked here, if you get access to this, the information about the 2 different studies the results are being disseminated from. And, we have the objectives here, the activities. I know the numbers have already been shared with you, but to disseminate across, 1,500 Grange halls with 150,000 members in 37 states, with the intention of ensuring that people can be better prepared and more engaged in their care. If it is of interest, there's a little bit of information here about each of the individual studies. So this first study about providing older patients with a list of questions to ask their surgeons. They wanted to know in this study if having that list helped to improve discussions and the decisions about the surgery. And then there are a few of the different, result areas that were listed here, and then the methodology if you're interested in how many patients were involved and, sort of how they did this work, how long it took, etc. And then the same for the second study, which is helping older adults assess their needs for future home support services. Really, focusing on sharing and adapting where necessary the Plan Your Lifespan website, which helps older adults and their families create a plan for getting home care as older adults age. It's really nice. This website is publicly available and free to use. It has been found to be incredibly helpful, so we're excited to have this one be disseminated as well. And in terms of what's already been done on this project and what's coming up, I've included here a short list of the things that have been accomplished. I know a lot has been done already, including all of the kind of website pieces and video pieces that were shared with you, the handouts, the thumb drives. A lot has been done. There are activities still in progress, and then obviously this is the national kickoff meeting, but there are still some exciting things to come in terms of learning more about what happens when this information reaches people, whether it's resonating with folks, whether sharing it has proven to be something that is easy or difficult, or sort of what can we learn about the process that has been put into place here, trying to share this information. All of which will be shared as a part of the final summary of the project and the evaluation plan. And lastly, I just wanted to share a little with you about ways that really anyone can engage with PCORI if what I've shared with you so far is of interest and you'd like to stay in the loop about the work. We have an ambassador program, which is a way for people who are not involved in research really can play any role at all, and don't have to be funded, don't have to be a part of a project, but they're just interested in helping to shift the culture of health research to be involved as a PCORI ambassador. There's information at the link provided here if you are interested in that. And if you look on PCORI's website, you can see that the ambassadors are highlighted there. There's information about the ones that already are involved in the program. There are different ways that people will, utilize that. They might be involved in a project. Somebody might reach out to them and say, hey, I see that you're really closely connected with this community. There's a great opportunity for us to work together, things like that. Or they might just invite you to attend something that it seems like you might be interested in. We also have a number of different advisory panels where people get to weigh in on decision-making about different areas of the work that we fund. And members will roll on and roll off on an annual basis. So the next deadline is going to be the end of March 2024. And I've included a link here if you are interested in potentially applying to be on an advisory panel. Our research studies go through a merit review process, and on that merit review panel, there are always patients involved or community members. So if you're interested in having a say in the types of research studies that get funded, you can apply to be a merit reviewer and potentially be put on a panel to look at applications and weigh in with your experience and your expertise about the types of work that should be funded. As I shared, there are a variety of funding opportunities, so there's a link there just to see which ones are currently open if you're interested. And there's also stakeholder convenings and events that come up, including PCORI's annual meeting, which is held every year in the fall. So we actually just had ours for this year. It is free of charge to attend, and this year there was a hybrid element, so you could attend virtually if there were sessions that are of interest to you. So just a plug for that, and any other events that come up that might seem like things you'd be interested in. That is all from me. So I will be happy at this point to take any questions that you have, or I can also leave you with my contact information if you want to reach out to me. Thank you.
Any questions for PCORI? Yes, Kevin.
Where does PCORI get their funding from?
The question is, where does PCORI get their funding from?
Very good question. So our funding is congressionally mandated. We're funded in this very unique way where we're authorized by Congress as a research institute. So the funding comes from a few different sources. Some of the funding comes from individuals. There's a minuscule tax that comes from everybody that goes into the fund. And then there's also an organizational element to it. So healthcare purchasers and payers pay into the fund as well.
Thank you. Questions for PCORI? Yes. Connie. Alexi.
Connie's my mom. It's okay. So with the program that we are promoting through the Grange. Okay.
She can't hear you.
Okay. So with the program that we are going to be promoting through the Grange, with reaching the rural, are we mostly focusing on seniors, or is it people with disability, or can this be something to address to people who live in rural communities in general?
Well, the program itself and the results of the research studies that are being disseminated are geared towards seniors. The Grange, really focusing on rural populations. The focus of the project, I believe, is on rural seniors explicitly, but I don't want to speak for the project team. If there's anything they want to add to that, they can feel free.
We are hoping that this is for all seniors, no matter where they live, because this information that's in the two guides, the trifold, if you're going to go see a doctor or have surgery, every question in here applies, certainly for seniors, but for you, for your children, if you're going to the doctors or a surgeon. All these questions are applicable, no matter what age, in reality, or where you live. As well, now the planning for your future guide is more for the more mature folk. The people that have children at home or in high school or college should be thinking about what their plans are for the future. At any moment, any of us can be in trouble. A car accident, somebody hits you, you fall. What do you want done with your health care? This brochure, if you look through it, and you can fill it out, it is writable, you can write on it. This is the high glossy version. There's also on your stick the printed home version, the ones that you would hand out at the fair, that you would take to your senior centers, Masons, wherever. There's that version, also same data, just a different copy capability. Phil was able to do that so that it is much cheaper to print on volume. But this is information that I haven't done it yet myself, but I need to, because it's where are my savings accounts? Do I have my multiple banks? Do my kids know that? Where to go to get my money, if I have any? Where is my paperwork, my will? What drawer is it in the dresser? Those are things that this brochure is for. And this is the one that you need to talk to your kids about, that we talked about. The important guide to planning your lifespan, planning your future. The one that Rachel talked about, planning your lifespan, is limited. We have expanded upon that by other research with elder lawyers, the gentleman that speaks, a Granger, that speaks to us every April from the foundation on planning your estate. He helped us build this. So that it's great information that you need to talk over and share with your family and friends. It's your desires. What are your desires? That's what this is all about. So they can advocate for you when you're in need. If you can't speak and tell somebody what you want, what you desire. And that's what that one does for you. So we're giving you 2 of those in your packet. One for you and one for your spouse, because you may be different than what your spouse wants. This is your plan for your future. And that's what you can hand out at the fairs and to other family members. I have 2 more things. Rachel, we want to thank you for awarding the contract to us, and we're looking forward to the opportunity to fill your contract requirements. These are the leaders of every state that now know what you expect from us and what we expect from them. And what they're going to get in return is our incentive program. The state, the first 15 states, that's the pink. I was trying to do pink for state award. Okay? You can get $500 if you do 3 of these 5 actions that are on that piece of paper that's in your packet or in the briefing. Okay, host an event on this topic at the state level, which might be your convention. Publish it in your state newsletter 6 times, which is every month from now until next November. Assuming you don't do one in July and August. So I gave you a break, you don't have to do it then. Or put something on social media all the time, a radio, a commercial, do a podcast, go, the folks, Debbie Vine, we need to get her, she's on the radio once a week, she needs to do it. Give a display at your state, county, Grange, fair, whatever you have, and incorporate this into your state convention. I will come to your state convention, present a program for you, this and something from the Grange Foundation, if you invite me. This is the outfit I will wear. So you're going to see it if you invite me. If you want, I can get there free. You got to pick me up at the airport, somebody's got to house me, and feed me breakfast. Breakfast is my favorite meal. And I will come to your state and do a foundation pitch, something we're going to play with you, a game this afternoon, and do this pitch. If you invite me, I'll get there. You just got to house me. Okay, for the community Grange. For the community Grange. Okay. The first 250 Granges across this nation that present a Grange program. Remember, we said that every lecturer can do this. Or they can print out these documents, hand them out, and talk about each thing that's in here. You don't even have to have the capability to show a video. You can do it freelance. Thank you, Vanna, for taking care of this mess I've left in your area. I appreciate it. So that's that community Grange can provide the videos, the guides. What about to your VFW? Don't forget the VFW. All the veterans out there, many of you are veterans. This is great information for them. They have TRICARE perhaps, but this is, remember, these are questions they ask your doctor, a small flyer, and what do they want done for their life and planning their future. They can have a display and go to social media. Do 3 of those. The first 250 Granges that do that are going to get $100. That's a lot for a Grange. What else have I got? I'm on questions, right? questions. You can capture me at any time. Betsy says my time is up, so capture me at any time and I'll be glad to help you out. Thank you so much for your attentiveness. We appreciate it. Good luck. Good luck. Good luck.
Thank you, Joan.